Now we are just on the point to begin to speak about stimulotherapy, and that's a new concept in orthodontics. Completely new concept in orthodontics. That means that you will really learn new things, new concepts, and then you will see how you will be happy at the end of this presentation. Today, young people, they think always in fixed mechanics. They think in brackets, in wires, mechanics, and how to align the teeth. But that is not a good thinking. It's not a complete thinking, because there is also the functionalism. And functionalism means not functional appliances. No, not functional appliances, because that is what people think, that functionalism equal functional appliances. No, functionalism means functions, means breathing, swallowing, masticatory pattern. Okay, multifunction system, it's our philosophy, MFS philosophy. It's a working protocol for the diagnosis and treatment of different integrated concepts. The next one is vertical nostrils and looking forward. The nose look forward, and the patient has a microrhinodysplasia from Bimler, you see, and the nostrils are inclined up. But we go now to the coding of the lingual mobility. So for us, the normal is that when the patient opens the mouth completely, the tongue contacts the palate. That is a 1. A 2 is that the tongue arrives just to the palate, but don't touch the palate. 3 is when the tongue arrives, goes up but don't arrive to the palate, and it's just under the upper incisors. 4, but you will see here the different devices. The first devices are the nose stimulators. Will be easy to put into the nose. You see here, the appliances goes into the nose, you see? Fantastic. These tubes works for all ages, not only children. You see here this patient, a young patient, young child. He puts the tubes on the nose, it's very comfortable. Or this lady, snoring lady, they use the tubes on the nose. You see here a patient with a 5 collapse, number 5, you see? 5 collapse, completely collapse on both sides. Result, this one. You have this result. You can compare with the other one. Amplification. And you see there is a big change between the beginning and the end. And how long, how many months you need to obtain this change? You need 8-9 months. And you put the obturator on the mouth, you see? And really you obtain a good position of the obturator. They must really take his work on the mouth. Another patient without fixed appliances, with nothing, with the obturator to control the mouth breathing of this patient. Yes, because you use a device that's very simple to use, very easy, by night also, always by night. And then you see we put inside the device, very easy to put inside, like a removable appliances, and then they will correct anterior open bite, these open bite appliances. This is the initial situation. You see also bruxismus here on the temporary teeth, and then the final. See what fantastic change you will see now. That's incredible, incredible change. And that's what you really need to use with fixed appliances, to correct the open bite. And here you see then that correction was not done. So we will use fixed appliances and the open bite devices. And we adjusted the open bite devices to the lower models, you see here, to the lower models of the patient. We adjusted here, you see, and there is good now to work on the mouth. So you see here, patient, open bite, with the open bite devices. And here, the correction. So we see here, from here, we go from here to here. Good result. This biplane is connected to the muscle relaxant, and there is an anti-bruxismus device. We have the biplane, and we put the plane inside. And so we have the biplane completely integrated to the muscle relaxant, and we have an anti-bruxismus device. We extract what? The other three premolars, second premolars, to control the occlusion and to change the occlusion here. We use also the anti-bruxismus device for what? In this case, to prevent that bruxismus interfere with our fixed mechanics. So we use the anti-bruxismus. This is another patient with crossbite, and here the anti-bruxismus device will work different. With work obtaining centric relation of the lower arch of the mandible, centric relation during the treatment to treat the patient easier. He has a crossbite, anterior and lateral crossbite, and then we use the treatment but with the bite plane, with at night the bite plane, and so the mechanics of this quad helix works very fast. This quad helix works very fast, expands one side, and obtain with this bite plane we maintain the lower arch in centric relation. That is very important to treat the patient and retain and maintain the patient in centric relation. No? And you see here the result, how we control the occlusion. And now we will finish this case with this new kind of self-ligating, aesthetic self-ligating brackets. Here you see, there are the new system with low friction, aesthetics, low friction, no ligatures, only one clip here in the center. That means that you have low friction, not a completely wall here in the front, no, only a small wall, only a small point they maintain or they retain the wire into the slot. You see here the change from here to here with central relation control with the anti-bruxismus device. And here you have the chart that you can use.